Good morning, everyone, and welcome to Compassionate Chats. I am Tanys Coughlan, and I'm joined by my beautiful co-host, Heidi Gagne. And we have a very special guest today. We have Jessa Blackburn-Perry. Welcome, Jessa. It's great to have you on the show.
Thank you for having me.
So, you are a nurse advocate.
Yes, I am a registered nurse. And one of the many hats that I wear in that role of being a nurse is a nurse advocate.
Yeah. So what does that mean exactly? What kind of role does that? I mean, we all sort of have the typical idea of what a nurse does, but this is a different role than that.
So I challenge the idea that nurse advocate is one singular role. I believe that all nurses are advocates for their patients, but it looks different from each nursing position. A surgical nurse would have a different advocacy than a home care nurse, and so on.
Right.
So my position is very unique. I volunteer with a home care company. Our name is Freiheit Care Inc. It's a local Ottawa home care agency, and we have a clientele base like most other home care agencies that vary in age, but the majority of our clients are elderly clients or complex need clients. So as a nurse advocate, it's to help people feel less overwhelmed. There's not a specific task list that I do for each client. Every client is very different, and their needs are different for levels of advocacy. So things that I can help do is look through care plans or even help create a care plan with them to help advocate for their care needs. I can help families understand a diagnosis. Important note, though, that I don't diagnose and I don't prescribe because that's outside of my scope of practice. So I maintain within my scope of practice as an RN. And I help our clients get the things that they need, or at least understand the system a little bit more, because this is an increasingly complex healthcare system that's difficult to navigate, not just for seniors, not just for those with complex needs. So advocacy starts with small conversations. It starts with conversations at the dinner table, casual chats with your neighbors, stuff like that. And I've moved on to learn a lot about our healthcare system, and I help clients navigate this system and just ease the burden of being alone and having to figure it out on your own.
And I would imagine, especially in this day and age, like we were just talking about before the podcast, everything is online. And I mean, for an aging population, for the older people that, some are great on the computer. Like my dad he's designed computer programs, so he's perfectly fine with computers and online work. My mom, however, is very resistant. She's very resistant to a lot of these things. She likes email and that sort of thing, but I mean, researching, and that's not her favorite thing to do. And so it must be difficult for people that don't have a husband who is tech savvy to have to figure this out. And I struggle when I Google something. I'm like, well, is this real? Like, how do I know? So having somebody that you can speak to who might have experience or at least knows how to navigate and understand what you're asking would be such a benefit. And
sometimes that means that I'm not the one who's hands-on doing this with folks. Sometimes it's liaising with caregivers and ensuring that the admin team has chosen the right caregiver for these clients' needs. And that can include choosing a caregiver who's a lot more tech savvy and can help navigate that system for our client, help set them up with the iPad, help them FaceTime with family, even just simple things like making sure that it's plugged in and charged and ready to go. And these are all things that get added into care plans too. Like I was saying, like nurse advocacy is not just having conversations, it's putting things into writing and empowering clients to get the care and get the things that they need.
And so can a nurse advocate, maybe not yourself with the role you play, but would a nurse advocate be able to go to, say, a doctor's appointment with somebody and help them through that?
Yes. So my position that I do, I'm not kind of on the front line in that sense. But we can send nurse advocates or caregivers to come to these doctor's appointments with loved ones, especially if folks are going to be receiving some news that could be difficult, or that it's very complex needs and they just need to be able to understand what the doctor is saying. Another thing that nurse advocates do is they help take that medical jargon that would have happened during that appointment and they make it more palatable, easier to digest for the client. We use simple layman's terms so that we're not confusing our client. And sometimes it's that break in communication between a specialist, a physician, a nurse practitioner, and a client. And there's just that gap that we help fill. So I don't personally come to appointments, but we do send caregivers, or what I can do is consult with folks ahead of time before their appointment and come up with a list of questions. And we work together. We can write it in an email and they can bring it with them to help guide them through that appointment.
So you don't go, but I'm assuming there are nurse advocates, other companies that might provide them that would have that more hands-on, that be able to go in with somebody during an appointment. I mean, it would just depend on where you find that. What kind of company you want to, how much help you need and how much assistance you need. I can appreciate that. I was recently in the emergency room with my daughter in Brockville, and we finally got to see the doctor, and she was having stomach problems. Every time she ate, it hurt. Every time she breathed, it hurt. Like everything just hurt. And the doctor started talking about all these things. Okay, mind you, I'd already been there for like 14 hours. So I was very tired. We didn't get much sleep. But, like he started talking about all these things. And I was just like, like, can I record you so I can Google this later? Like, it was very overwhelming. And it was just, I mean, she turned out to be okay. And everything was fine after, a couple of things that we had to do. But I mean, it was just so overwhelming. And it was simple stomach problems. And I was like, how would you do this if you're sitting there with a cancer diagnosis or with some unknown, very small disease that not a lot of people have, and how overwhelming and frightening it would be to not have somebody there that can relate to you and provide you layman's terms, because I don't know why doctors have to use medical terms to layman people, but here we are. I just think that having somebody there for you, or being able to review transcripts if you record it, to have that kind of information to help you must be so helpful and so calming for somebody during a very stressful time.
Mm-hmm.
And even if there can't be somebody present during the appointment, a third party like a nurse advocate, what nurse advocates can do is afterwards review the report that you would find on Epic or the MyChart system and go through that, because like you said, you were in an emergency room for 14 hours. We don't know when we're going to emergency, if we're going to be brought right to the back, or if we're going to be waiting half a day, a whole day to be seen. So it'd be difficult to kind of anticipate that need with some folks, especially elderly who have had a fall or some sort of emergency that wasn't foreseen. But definitely services like nurse advocacy can be helpful afterwards as well to help distinguish kind of what the next steps might be, or even just to have somebody as a sounding board to help explain this jargon that sounds like it comes from another planet.
It really does.
Yeah, are they open to recording stuff usually?
That depends on the physician or the practitioner. Yeah, it's really dependent on them. I know a lot of policies are for no recording, but it's something that you could definitely discuss for an accommodation ahead of time.
Yeah, if it was more of a regular appointment that you had to go through, or you've received a diagnosis and there's going to be multiple follow-ups, and being able to have somebody there, or if they can't, at least being able to have a transcript or something of being able to understand, because it's really hard. Your brain is split in half, right? You're trying to listen to what the doctor and the specialists are saying, but then on the other hand, everything is racing through your head.
Yes.
At least it does for me, but that could just be my anxiety. I don't know.
Well, I
But
think it's going to anyways, right?
yeah,
Because you're going to be either you're in pain or you're dealing with a health thing, or your loved one is, and so you're distracted even by that.
Yeah,
More
it's
than,
like being pulled
you
in
know.
multiple directions. You can't be 100% present for that conversation at the same time
Yeah.
being there for your loved one who is probably frightened, or they could be confused by what's going on. Why am I here? Why is the doctor saying words I don't understand?
yeah,
Well, and I guess that's the benefit of my chart, right? Because at least you
Yes.
get some indication of what they've said
Yes.
in the reports and stuff that you read. But I think even those require decoding. So that's definitely, I bet that's
Yeah.
something that you do a fair bit of.
Yeah. And sometimes something can seem incredibly scary. Like some
Yeah.
of these big words, you're like, oh my gosh, this word just sounds like that's it. We're done.
Yeah.
And it definitely needs decoding because you have to take into consideration the other words that are accompanied with it, the other big fancy words.
Yeah.
And so that's where our position comes in, where we can help, read that, decode it, and just provide reassurance, or maybe ask some questions that they didn't know to ask. You know what I mean?
Mm-hmm.
so
Yeah. And with, oh, sorry.
no, go ahead, finish your thought.
I just want to say that with advocacy, like sometimes it is clinical, but a lot of my advocacy work is emotional, if that makes sense.
Mm-hmm.
It's a lot of just reassuring clients and familiarizing them with what potential next steps could be when they're kind of lost in the chaos of a new diagnosis or a worsening condition.
Mm-hmm.
Yeah. Okay, I just want to touch back. I have been very
Yeah.
lucky in my life, as has my family, that we have not had many medical issues, barring my daughter's one recent issue. What is my chart? Does everyone have access to that? I've heard
So,
people reference it, but I'm like, I don't know if I have. I don't think
yeah,
I've.
so My Chart, you can download the app My Chart and you can link it up to any of the hospital's electronic medical record systems, so these EMRs. And you essentially can get your results. I mean, you could be sitting in the emergency room and see your daughter's results for blood work before the doctor even pops in to explain to you, which
Oh.
can be difficult, especially if
Yeah.
something comes back and it's not good news, right? You haven't had somebody to sit there and reassure you kind of, oh, okay, this looks like it's really bad, but we already have a plan that we're going to follow. So it can get you into trouble if you're somebody who's sitting there in the emergency room just constantly refreshing, looking for those results. There used to be actually something you had to click on when you first downloaded it saying, like, I agree that I could be getting these results prior to a clinician reviewing them.
Right.
And kind of that risk that comes along with it. But yeah, it's essentially the platform to review your EMR.
Mm-hmm.
Oh. And so that's not your doctor. If you have a general practitioner, it's not that. It's anything that you might go through. Okay.
A specialist in the emergency room. If you went to the hospital or any of the off-campus, like hospital, what would you call it? Their satellite clinics that they would have. Like Mall 4 has an MRI and CT scan out in the East End. Stuff like that would be put up on the EMR.
Okay.
I know for us, we were with the family health clinic at the Civic. And so that stuff goes on there as well, because we're part of the hospital system, I guess, with that.
Okay.
So that's interesting. Yeah. I know my dad, when he got his diagnosis, it was actually in My Chart before he got told. And that was a little bit troublesome because it was cancer. And so it was,
Yeah, that's a very broad result without any kind of help, you know, like hearing anything, the good, the bad, and the ugly kind of thing. You just see the bad. You just see a terrible word that is devastating for many people. Yeah, I think I would avoid My Chart until I knew. Like, I don't know. I'm way too anxious for that sort of thing. I don't think I could do it.
I think you got to weigh it, because sometimes you're anxious because you don't know. At least once you know, you can deal with it. So it depends on who you are, whether that's beneficial or not.
Yeah, I'm in the other camp. I want all of the information, even if it's bad, give it all to me so that I can make my informed decision. But I also recognize there's a privilege in that I have the education and the healthcare literacy behind it, whereas other folks don't. So they just, I don't want to read it. I just want to hear from the clinician. And that's
but it
great.
gives you an opportunity, like you have those results from the doctor, but it also gives you that opportunity to talk to a nurse advocate or somebody with that history and say, hey, can you help me understand what this means? Because I know I would. I know me personally, I would be more panicked with the unknown, and seeing those words and not knowing what they mean. And then you go into the spiral of Googling everything, and that's you should never Google medical things.
No.
Never
Dr. Google is not
things.
so good.
No, that's a dark rabbit hole that you never really want to get into.
Yeah, definitely.
So what makes a good nurse advocate? What skills? What personality?
What personality? Okay, so you have to have kind of this neutral stance where you're not being confrontational. You're not pressuring clinicians on behalf of your client, give me answers, get us an appointment sooner. That's not what it's about. A nurse advocate, what makes a good nurse advocate, I guess, would be good communication skills, listening to what the client wants, definitely gathering as much information as possible to have a good sense of where some of the gaps are in the client's care and where their gaps are in understanding, but also what they have declared are their needs.
Okay.
So just kind of being open to being fluid with how our healthcare system is. You constantly have to pivot, change goals of care, stuff like that. So you have to be somebody who's very flexible, you open to good communications, but definitely not confrontational, because as much as it can irk you sometimes to hear how folks are being treated or mistreated, you have to not take that personally and not bring that home with you. But you also need to be up to date on kind of best practices. Things are always changing. There's new programs coming up, stuff like that, just so that you can really help your client help themselves.
And how would you, so if somebody is a nurse, they've been a nurse for a few years, when is a good time to start? If you're interested in becoming a nurse advocate, when is the time to start? Is it when you're still kind of new in your career, or should you have more hands-on experience before moving into nurse advocacy?
That's a great question. I guess the best time, start when you're in nursing school. Start with day one. The first time you meet clients. I mean, start the first day you show up to your first class with your syllabus. You don't have to wait to graduate to be an advocate. You don't need special credentials. Ask lots of questions. Be curious. That's probably my main thing that has helped me on this journey, is just my curiosity and asking questions, whether it's to clients, clinicians, case managers. I just want to get to understand these systems, and it's not in a way so that we can play the system in any way. It's so that folks can get the care that they deserve, and kind of find that balance between what they need and what they want.
Okay. Now, a nurse advocate can't speak for a client in a medical appointment, right? They're just there as sort of, or they more are information gatherer and explainer versus, speaking for a client. Is that, I'm assuming that's correct? Or can you?
I try not to speak on behalf of my clients. However, sometimes an accommodation is needed,
Right.
Whether it's somebody who doesn't have the capacity to speak for themselves, somebody who might be really overwhelmed and might just shut down during an appointment, stuff like that. So what I try to do for my clients is provide them with speaking notes before the appointment, whether it's questions or concerns that they want to bring up, stuff like that. I guess that would be the best way to go at it, is allow your clients to speak for themselves, because my position is to empower them, but also to educate them and help them with that healthcare literacy portion.
Oof, that's very daunting.
It is.
It is.
It is. I also want to say probably the best way that I've learned outside of, just being a nurse is my own personal, healthcare journey. Family members who have been hospitalized, not just, overnight stuff, but for weeks on end, trauma units, ICUs, stuff like that. You really get to see kind of the back end of healthcare.
Right.
But it's definitely interesting to be both on the receiving end, both sides of the healthcare bed, to be the one showing up in the scrubs, but also to be the one putting on the hospital gown. That's probably when I've learned the most.
So do you find that that clinicians and hospital staff and everything are receptive to having an advocate, or do you find that they are still kind of like, well, what are you trying to tell me what to do? Or, you know what I mean? Like, is there a sense of teamwork from a lot of places? Or do you find, I mean, I know everyone's different, but it just seems that we all have to advocate for ourselves. But I'm also feeling old school because I'm like, okay, well, the doctor knows more than I do when it comes to things like that. So I would feel, I don't know, I wonder if there's ever pushback from medical professionals for somebody.
I think it's a different set of skills too, right?
I would hope that that's what they would look at.
Yeah.
And it's I'm not coming to clinicians in a threatening way. I'm working within my scope, so I'm definitely not, trying to diagnose the client. I'm empowering families, empowering the client. I'm documenting very carefully things that are brought to me. And so a lot of the times I don't have to say anything. A family member will simply, pop up on their phone with the EMR and say, well, Jessa wrote a note based off of, feedback from the caregivers, and that's why this is an issue. And in my notes, I will detail instances that they can refer back to. I don't really get pushback from a lot of healthcare professionals. It's more an appreciation of helping them maybe answer some questions that the clients couldn't answer, or to bring a different perspective that's very third party.
That's good to know. That there's reception to that.
Yeah.
You almost play translator in many ways, right? I mean, that's kind of what you're doing. You're translating both ways, because sometimes the doctors are not understanding necessarily what the client is meaning either. So I think, that can happen too.
It's like when you go, well, for me, in my case, it's my husband knows more about vehicles than I do, but I'll tell him that the truck is making a bloop, bloop, bloop sound. And then he'll be like, okay, tell the mechanic this. I'm like, okay.
Yeah.
That sort of thing, because I don't know what it could be. I mean,
my stomach's making a gloop, gloop, gloop sound. What does this mean?
But it's true, though. Like, it's true. Like, I mean, there are times when my daughter was trying to explain what she was feeling and everything to the nurses, like, she had to explain it 3 times. She had to explain it to me. Of course, I tried to go on telehealth to see what would happen, they would say if there was anything. Of course, everything kept telling her she was pregnant. It's not possible. I like how that was the backup, that was the first thing, but no, she's not pregnant. And so that was really difficult, because I'm like, I don't know how you're feeling, but I'm trying to provide other options to her. So having somebody who can kind of help you pinpoint before going to the doctors is also helpful. You would have been helpful that night at 7:00 at night when I was trying to figure out what was wrong with my kid, and she couldn't eat anything for 2 days. So that would have been nice.
Hey, you have my number. Come on now.
I do. I should have just texted you, Jessa, help.
You would probably not be the only one that night who would text me. Sometimes, you know what? I prefer the words, because sometimes I just get photographs with no warning. So I appreciate the texts.
Oh, yeah, a random photograph of something. Yeah, that would be a little frightening,
especially when it's wound care or something.
Yeah, or the game, what's this rash?
Right. Yes.
Yeah.
That's fun.
Yeah.
I'm dealing with that with my dog right now. My dog is sick and he can't tell me anything, so it's even harder.
It is tough. It's really tough with when your patient can't share what's wrong.
Yeah. We actually have a good comment here on our comment page, Tanys. It says, well, and with doctor's appointments, you may have 15 minutes to talk to the doctor or specialist, and it can be so stressful to try and speak and remember everything you want to speak to them about. That is a huge reason for having, a nurse advocate who can help guide you and to that conversation and be able to help. That would be frightening. Like, I know when I'm in a tough situation, mine is I freeze. I don't fight. I don't flight. I just freeze. And then I don't know what I'm going to say. Yeah. So
even for my own doctor's appointments, I come in, I've got, my trusty book with all of my stuff written down. And I'm the same way, even for my own healthcare, but there's a difference when it's my clients. It's not personal to me. I care about clients. I want people obviously to get the healthcare needs sorted out, but there's an emotional impact to that of trying to almost dissociate yourself from that. But in the same time, it empowers your client because, you and I, when we go to our appointments, we freeze up. We're like, oh, I don't want to say anything because, I don't want to be gaslit again by that doctor who told me, clearly it's hormones or that's normal, that kind of pain.
Women your age.
Right. But well, you are getting up there.
Yeah.
Right. Like those kind of comments. Right. But it's just, no, that doesn't have to be the answer. And it doesn't have to be confrontational. And sometimes it's just, empowering people to have that question of, but what if it's not whatever issue the doctor said, that let's sweep it under the rug. And I understand they are overworked. They are stretched in so many different directions all at once. So this is not a jab. These are my colleagues. I love collaborating with physicians and nurse practitioners, all sorts of clinicians. But sometimes they get into this habit of like, I've seen the client for the same thing. We've ruled out a bunch of stuff. When you hear hooves, when you hear like the footprints, the hooves, you need to think that it's not a zebra, like the rare, scary thing, but rather it's a horse. Because it's always been the horse. But what if it is the zebra? Right? And sometimes clients will think, well, my doctor doesn't care, whereas they don't understand that maybe some test has already ruled out what you think that zebra might be, and it's lost in translation with that jargon. And sometimes the physician's like, you're right, actually, you do fit the criteria now, or I overlooked that. Let's order the tests.
Yeah.
Right. Well,
so that's where advocating for yourself is important, right? Because there are sometimes, they're human just like everyone else.
I was just going to say that they are human. And
and my goal is so that my clients can advocate for themselves, that I don't need to be there talking to them prior to every appointment, or they don't have to have a caregiver booked with them or a nurse advocate that would be present next to them at the appointment. It's kind of to help them navigate the system, but also I help them help themselves.
Now, I don't know if you find this, but I do find as seniors age, there can be this anxiety that creeps in over, like it's a widespread anxiety that starts to come in. And sometimes, of course, beginning of dementia will create this for people, but sometimes it's just like everything's changing and I don't know how to handle this kind of thing, right?
Yeah.
So how would you advocate, not advocate necessarily, but empower when they're in that situation? Because that's really, it's not necessarily something that they can deal with on their own. They need to talk to somebody about it, but often they're very hesitant when there's any mental health going on.
So I guess I'm pretty discerning when it comes to mental health stuff. I'm a first responder with PTSD and I have a service dog with me. So right away people see the dog and they're like, you're either training or there's something going on. And so I always clarify, no, I'm not a trainer. She is my service dog. She is my medical service animal. She does PTSD and cardiac work for me, which she has been a lifesaver. But it's disarming for folks when they realize, and I'm always open about it. Sometimes she's snoring in the background when I'm with a client on the phone. So I'll tell them, listen, I've got my service dog with me just in case you hear snoring and not falling asleep on the phone with you. But that opens the door. It opens the door to like, let's talk about mental health. It's just as important as the rest of your body. So that's good. But also the best way to approach a scenario like that is ask questions, be curious.
I think that open and curious is the biggest sort of thing going in, isn't it?
Yeah, open, curious, and don't have walls up. Don't come in with well, you haven't been treating my client properly. Like, you want to come in like, guys, we're a team. Let's all work together. Where's the gaps? Let's be curious and find what's missing. Let's fill those gaps. And if we don't have things to fill those gaps, or we don't have the knowledge, let's find the knowledge.
Mm-hmm.
Yeah.
Well, I can't believe that the half hour is
That went so
already
fast.
here.
It's already done.
If you could say one thing that would help people, what would that be? What should they focus on?
Okay, I wrote this one down. Okay.
Very good.
It's my strong closing point.
Yes.
It's that advocacy isn't about fighting the system. It's about making sure the person at the center of the system doesn't get lost in it.
That
Very
is
nice.
very good. Yeah.
Can you repeat that, please? Just so we have
Absolutely. I will be reading it again, though. Advocacy
Absolutely.
isn't about fighting the system. It's about making sure the person at the center of the system doesn't get lost in it.
Beautiful.
That is wonderful. Yeah.
Mhm.
And that is the case for any kind of advocacy.
Yeah.
Is just making sure that they're not lost.
Absolutely.
And that they're not alone.
Yeah.
Awesome. Well, thank you so much for joining us, Jessa. It's been such a pleasure.
Thank you for
and
inviting me.
I'm sure we'll have you back again soon to talk about other stuff. So
Yeah, I'd love to be back anytime.
Thank
Excellent.
you.
All right.
So, stay
I just
tuned
did want to say one last thing.
Of
That
course, yeah.
if folks are looking to find out more information about nurse advocacy, what that looks like, or other nurses are interested, Freiheit is the home care company that I volunteer with, but they will be having an upcoming event at the Canada Seniors Council coming up in this spring. So I know that My Place Home Care will also be there. So if
I
folks
believe
want
so,
to
yes.
check out the dates and locations, you can find it on the Freiheit website or the My Place Home Care.
Excellent.
Yep. And Freiheit information is below in your comments.
Excellent.
So we have
And
all of that
awesome.
contact information.
And just
Okay,
to note, My Place Home Care, we do partner with Freiheit. So
Yes.
we have found that we have partnered with a few home care companies in Ottawa who have similar reasons for being around and the way we advocate for our clients and everything. And we found that working with other home care companies has allowed us to really be able to provide for our clients more fully, because maybe we can't cover absolutely everything, but in partnership with Freiheit, we can create an amazing care team that will be there for someone's loved ones and their needs. And I think it's revolutionary, and there's not a lot of companies that actually do this. So it is really great to see another face of Freiheit, who I get to talk to quite regularly.
Compassionate
Awesome.
collaborations, right?
We
love it.
Compassionate
Collaboration is the key.
All right.
Beautiful.
Have a great day, ladies, and thank you so much.
Thank you. Thank you
you.
all. And please remember to join us at the end of the month for our compassionate conversations. We'll see you soon.